I'm the designer of the system. I designed it 15 years ago. I've been in this field for about 30 years. What we do is this. I put up a couple maps for you to see. When you map the brain, they're looking at the electrical potentials that the brain makes. Right? And we want to see if there's any damage there. And a lot of people get injured and don't know they've been injured, right? You guys probably know if you've been injured, right? But some people have depression, anxiety, or substance abuse issues, and they never get treated for it the right way. Right? They get the psychotherapy, they might get medication, but that only takes you to a certain place. It doesn't actually help to rehabilitate the problem, and that's the organ that we're treating. So when we bring everybody in, we want to see how is your brain actually functioning. And so right here, there's a test that we give you where you click the mouse every time you see this go, and when you see the no, you don't do anything. Okay? And we're hitting you with a whole bunch of trials, 800 trials. Now, we're recording your brain while you're doing this. Now, with EEG, every second of data is 256 observations of the brain. Okay? You get 800 seconds, which is over 100,000 observations of the brain by the time we're done with the analysis. We take that data and we feed it into a machine learning algorithm that was designed at UC San Diego. And this thing is a learning program. It learns how your brain is functioning. And then what we get is this. Now, this is the event-related potential. And what you see here, this is pre-test, this is post-treatment. Okay? So this guy comes in, he's got a brain injury. How do I know? Well, there's certain areas that you learn how to read these squiggles, right? You should get a certain kind of response. If you don't get it, then you say, wait a minute, that region is attenuated. Okay? So if I hit your knee right now, I should get a reflex, right? If I don't get that, that's a problem, right? Now, the number here has to be greater than 5 microvolts. This is like 5.3. It's right on the cutoff, okay? This is telling me that there's a significant problem there, right? The output isn't strong. Now, after 15 sessions, he's at 7.45 minutes. And this guy will come back and tell you he doesn't feel depressed anymore. And he's like, yeah, it's kind of strong, Ron, because I really don't know how to actually explain it, but I feel different. And when we do the brain mapping, we're looking for where the slowdown is. If you're white matter injured, you're going to have a lot of slow wave activity, which means you're in a brain fog. You can be depressed, you can have all sorts of different functionality issues. In most cases, we're going to want to speed up the brain, right? So we usually we use a combination of random noise and a speed, a frequency, and we tie them together, and that's what we get. And so depending on whether you're going too fast or too slow, what's your issue? Anxiety versus depression. Anxious people, their brains are usually going too fast, right? And so those we got to slow them down. Or insomnia, right? You know, got to help that brain to enter into a parasympathetic state. And so we do that as well. So the protocols are designed. The brain's pretty complex. Right? So there's a lot of different ways that you can give energy to. And if you do it the right way, you can feed it what it needs, and it will use it, and then you'll start to see that in your behaviors. You get overlaid injuries and you don't get better, you don't get treated, that stuff doesn't go away. It's going to stick with you. And so it behooves you to get treatment so that we can stabilize this. You got to take care of your noodle.